City of Alameda's first Mayor's COVID-19 Town Hall. My name is Sarah Henry. I'm the city's Public Information Officer, and I'll help moderate today's event. Mayor Ashcraft invited special guest Coleen Chawla, who is the Alameda County Health Director, and we're so happy to have her join us today. Both the mayor and Ms. Chawla will provide introductory remarks and will then answer your questions. All participants have been muted. To submit a question, please use the chat feature, where you'll be submitting a question directly into the moderator. And following opening remarks, Mayor Ashcraft and Ms. Chawla will be able to answer those questions. So I'd now like to turn today's town hall over to Alameda Mayor Marilyn Ezzy Ashcraft.
Thank you so much, Sarah, and good afternoon, everyone, and welcome to my first, but not my last, we're going to do this weekly, from here on out, virtual town hall. And I am delighted that you could all join us, and I am especially delighted and really honored and so grateful that we have our special guest, Director Coleen Chawla, who is the Director of the Healthcare Services Agency for Alameda County. She is one busy woman these days because her agency includes the county's behavioral health, indigent health, public health, and environmental health programs and services. Ms. Chawla became director of this agency in December of 2017 with more than 25 years of prior experience in the public health sector, most recently as deputy director of the San Francisco Department of Public Health. She also worked in the 7 years with the AIDS Project Los Angeles, and I believe she told me that early on she worked in San Francisco during the HIV/AIDS crisis. So we are so fortunate to have both a proactive rather than reactive governor in Governor Gavin Newsom. And I cannot say enough about how wonderfully the county's public health agency has been working with all the cities in the unincorporated areas of Alameda County, as well as with our neighboring counties to keep us all safe during this public health crisis. So with no further ado, I want to introduce and turn the microphone over to Director Coleen Chawla. Welcome, and thank you again for taking time out of your very busy life these days to speak with my residents.
Of course. Thank you so much, Mayor Ashcraft. It's really a pleasure to be here, and thank you for giving me the opportunity to speak directly to residents of our county. I think it's really important that they hear from all of us who are working tirelessly to make sure that our county the impact of COVID-19 is minimized across our county. So I thought I would talk a little bit about what the local public health department role is, specifically as it relates to this epidemic, and then what our larger role is in our overall county response. And then talk a little bit about the shelter-in-place order, and I'm happy to answer any questions, any other questions, of course, too. So just in terms of the public health response, because this is a public health emergency, we have a unique role in the public health response. We have been activated in an emergency response structure since the middle of January. So it's been quite a while that we've been working on this. As a public health department, we are responsible for identifying COVID-19 cases, for isolating people who are ill from COVID-19 so they don't spread to other people. We are responsible for contact tracing. That means interviewing everybody who's a positive case and their close contacts and quarantining people so that those at risk of developing disease are separated from other people. And we monitor the data for trends and predictions. Those are our core public health functions that we do on a daily basis, and especially as it relates to COVID-19. We also have a role, though, in the county's broader response. The county opened its Emergency Operations Center last month, and it's a unified response with the Sheriff's Office, who is the Director of Emergency Services, and the Public Health Department of the Healthcare Services Agency, which is, in a health emergency is part of the unified command. So part of our role there is to monitor our hospital and emergency response capacity in real time. So you may know the EMS agency sits within my agency, and that means that we're looking at 911 call volume and hospital capacity every day, every hour. And I can tell you that our 911 call volume is down. Our hospitals are operating below capacity, which is good, which means people are sheltering in place as the directive provides. We provide supplies to our healthcare workforce and our first responders. So we have a robust mechanism to get supplies, personal protective equipment, and other supplies out to our first responders and healthcare providers. We're working to support special populations who are particularly vulnerable in this epidemic, such as our homeless residents in our county. We're working on predictive modeling to project what the impact of COVID-19 will be on our county using models that have been developed in places that have seen this disease move more quickly in their communities than we have in ours. We are working to increase the capacity of our healthcare system, making sure that those predictions tell us that we have this sufficient healthcare capacity to serve everyone with the care that they need when they need it. And we're also providing timely and regular information to the public to ensure our community is informed. You may know, I know Mayor Ashcraft, you in particular, are aware of our new dashboard that we posted on the Public Health Department's website. And it shows the current status of cases and deaths and some demographics on each of those on that website. Right now, we have a total of 713 cases in Alameda County. That was as of yesterday. They get updated right around now. And then 19 deaths in Alameda County. The data will be including race and ethnicity by the end of today. So we'll have more detail on the cases. The one thing I want to say maybe about the testing data, or sorry, the case data, is that the limitations are on the availability of testing. So it's not necessarily an accurate picture of how much disease there is in our county, but it is a picture of who's been tested and where they were when they lived when they were tested. So maybe just to wrap up the opening comments, just to say that the most important message is that the shelter in place appears to be working to flatten the curve in Alameda County. We are seeing evidence that it is working. And I know it's really difficult, but we have to keep it up in order to make sure that we minimize the impact of COVID-19 in our county, and that we make sure that our healthcare system can handle the patients who will need care during the peak of our disease here in the county. So still, it is true that maintaining sheltering in place, covering your face when you go outside for essential activities, and continuously hand washing continue to be the best ways to protect us from COVID.
We're going to figure this out. Thank you so much for all that valuable information, Director Chawla. I know I'm assuming our audience is submitting some questions, but I just want to touch on a couple of them that I was thinking of. We have heard as of last week, when our county public health director, Dr. Erica Pan, and the CDC came out with enhanced guidelines for maintaining physical distance, but also the recommendation to wear face masks when out in public. Can you talk a little bit about that? Because I know some of my residents have had questions.
Certainly. So as more data emerges on the transmission of COVID-19 or coronavirus, it is now seeming that people can be contagious before they are symptomatic. So up to 2 days before they're symptomatic. So covering your face helps keep you from transmitting the virus to other people if you are positive and you don't know it. So it's more about containing your own symptom or your own contagion from other people than it is the other way around. But it has limited effectiveness the other way around. But it's really more about, if everybody covers their face, people who don't know that they have the virus can keep themselves from infecting others.
Thank you. And you talked a bit about the importance of maintaining these guidelines or continuing to follow the shelter-in-place orders. We, as I'm sitting here today, the sun is out. It's a beautiful spring day. This weekend for many people is Easter Sunday. And yet we are telling people, please, you can walk outside and get your fresh air, but still by maintaining physical distance. What can you just tell people, remind people who might be tempted to picnic in the park, organize an Easter egg hunt for the children, get
Yeah.
together?
Yeah, and I know it's particularly hard during these times when we have events that encourage us to get together in the past, encourage us to get together, these observances where gatherings are normal, like religious gatherings. But the shelter-in-place order does still persist, and we are asking that that congregations and others refrain from having contact with any members of the community outside of their own household, having in-person contact. We definitely encourage worshiping via this method or FaceTime or others. But in person and even drive-by really could unnecessarily expose our community to COVID transmission.
And one of the things that I worry about these days, and I worry about everything these days, but is not only people's physical health, but also their mental health and behavioral health conditions, which can be exacerbated by this imposed isolation we're having to address. So what can you say about resources available or what the county is doing in that regard?
So fortunately, behavioral health is part of the agency that I oversee, and they are a partner in the leadership team for the COVID response for our agency. We recently issued or released a series of public service announcements, which are available on the public health or on the county website.
Oh.
And one of them is about protecting your mental health and that of your children. So we'll continue to release those. We have, I think we've recorded and released 5 so far. Additional recordings are taking place actually today. We have a plan for about 15 of them. So it's a way for people to hear directly from leaders in our community about various issues. And our director of behavioral health is recorded the one on mental health.
Very nice. And if you could just give our listeners your website for County Public Health.
Well, you can just go to acgov.org, and right prominently on the front is coronavirus links. So if you take the coronavirus link, it'll go to the Public Health Department website. But if you scroll down, you'll also see the public service announcements.
Excellent. Thank you. And let me just ask our Public Information Officer, Sarah Henry, are we getting questions from our audience?
We are. We have a number of questions.
Cool.
So I'll start with a few. The first one, I'm just going to go back to the beginning. So some of these might be out of sequence, but the first one was just referring to the dashboard and asking why Alameda County was later to release the demographic information for cases compared to other counties.
I regret that we were later than other counties, but I'm really happy that it's up now, and we're continuing to improve on it. And we have many phases in the planning. We have many different releases in the planning phase. So next week, more data will be released. So we hope to get it up and as useful as all the other databases out there immediately.
And this might be part of that, but somebody asked when or will we be getting the demographics for those people who have died? We have the age groups that's currently up on the dashboard now, but to be able to connect those to the mortality rates, will that be available in future iterations?
Yes, one of the challenges that we have is maintaining confidentiality. And fortunately, the number of deaths that we have are relatively few. And the state guidance has been, though I know that not all jurisdictions are following it, but the state guidance has been that we don't report cases below 10 by number. And so our current deaths are at 17, and so most of those subgroups would be below the number of 10. So we will continue to look at that, but right now we're following the state guidance on that.
Okay, and here's another question. Where does the funding come from for the county program, and is there enough to continue at a high level for the foreseeable future?
That's a very good question. So because it's a public health emergency right now, it's being fully covered by people being redeployed from the jobs they had to help with the response in public health. But ultimately, FEMA, the Federal Emergency, I'm going to get Management Agency, will reimburse counties that expend funds, or count any localities that expends funds on the response at the rate of 75% on average. So it will require that our county advances funding in order for us to continue to expand the work that we do, in the hopes that we'll get a large amount of it reimbursed at some future date.
And then here's somebody just seeking some clarification for what you said earlier. They heard that it can be contagious and pre-symptomatic for up to 3 weeks, but they heard you say for 2 days, and so they wanted to get clarification on that.
So I think that might be mixing up two things. There's a 2-week incubation period. So if you are exposed and it will take up to 2 weeks for you to show symptoms and potentially test positive. But once you're positive, you may be contagious for 2 days before your symptoms show up. So I think it's maybe a mixing of those two things.
Okay, and here's one for the mayor, talking about how Oakland just converted 74 miles of streets to be bike and pedestrian ways, no cars. They'd like to see this in Alameda. Do we have any plans? And if so, how can folks help? Oh, I'm going to unmute you. You're good to go.
Yeah, thank you. I heard about that on KCBS this morning, and I can tell you that it is being discussed at with the city administration. And I applaud what Oakland is doing, and which is that they, as you noted, they're closing down so many miles of streets to automobile traffic, because we do have more people home and they are wanting to get out and get some exercise, and that's healthy, but yet they cannot be rubbing shoulders and being close together, because that's not the required 6 feet. So we are looking into it in real time. And I just want to give a shout out to our city government at this time, because I can tell you that our folks, Sarah Henry's one of them, she's working day and night, 7 days a week, getting messages out, but our city manager, all the department heads are working together and having to make really fast decisions and fast turnaround. So I know, because I emailed them about that very question this morning early, they'll be back maybe even while we're speaking.
And here's another one, Mayor. What, if anything, has been different about Alameda's response as compared to the county and the state response?
Well, starting with our county, I will say I was really impressed with when the public health directors of our 5 most populous Bay Area counties and the city of Berkeley, which has its own public health department, all came out on Monday, March 16th with this first shelter-in-place order. 2 days later, our governor followed suit. Now he is overseeing the whole state, but I understand that our counties were the first in the nation to do that, and so I think that this just feels like a race against time. We're all trying to do what we need to do to slow the spread of this disease, as Director Chawla said, so we're not burdening our hospitals, and we're saving lives. And so what Alameda is doing differently than the rest of the county, I don't know. I know the mayors, by the way, the 14 mayors of Alameda County, we're in touch. We text late at night, early in the morning. We've had Zoom calls. We're all working hard. I'm a little on the competitive side, so I'd like to say that I hope my residents are just really putting in the extra effort, because I want to see my city's per capita COVID numbers be the lowest out there. And by the way, I want to see our census return numbers be the highest out there. So don't let the COVID-19 stay-at-home orders prevent you from completing your census, because you do that online. but I, again, and I've said this a number of times when I've spoken to groups. I just talked to the Rotary Club yesterday. I think we are so fortunate as Californians that we live in a state with a governor who's a former mayor of San Francisco, and certainly, and in fact, Director Chawla might have worked with him. But he was proactive rather than reactive. He has established at least 13 different task forces looking at the COVID-19 from all different perspectives. And then we have our, and he issued his stay-at-home orders, and he's not equivocal. He's not saying, oh, but I'll make an exception for religious gatherings, or you can go to the beach on the weekend. He's not doing that. And our county public health directors, at least I'm aware of what they're all doing, the 6 Bay Area county public health directors. It's so smart. They're working in tandem. They are issuing the same orders jointly because this virus doesn't respect county lines, city limits. It's out there, so we have to keep all of our communities safe. So I'm really grateful to be an elected leader with such strong, smart leadership to guide me.
This one is more of a, I think you've already answered it, Director Chawla, but they said, I understand there are 21 COVID-19 cases in the city of Alameda. I think now we're at 22, but have there been any deaths in the city of Alameda, and have we traced the COVID cases to essential workers? But I think that goes down to the numbers.
That's right. That's right.
Okay. For the mayor, what proactive steps are you taking as mayor to mitigate the impact of COVID-19 and the economic damage to the residents and businesses of Alameda?
Yeah, there are so many wide-ranging impacts of this epidemic, this pandemic, and it came on very quickly without a lot of time to prepare. So what we're doing as a city, just at the last city council meeting this past Tuesday, is the city council approved an urgency ordinance that went into effect immediately, preventing any renters, and this is residential or commercial tenants, from being evicted for non-payment of rent due to COVID-19 causes for the duration of the governor's emergency declaration and a month after that. And then when we have passed that time period, and we will, everybody, we're going to get through this, but then the repayment of the rent starts. But the council gave residential tenants, and I think commercial too, I need to double check on that, 6 months, 180 days in which to start to pay back the suspended rent. And we may change that day. One of the things that we have to all do is be very nimble and responsive to new information as it comes along, and we'll see what the duration is. We also imposed a freeze on rent increases for residential properties until September 1st. We are not able to do that with commercial properties because it's state law, and we have to abide by state law. We are going to be looking at other ways that the city might be able to aid our businesses, some financial aid, but we've also, our community development, economic development department has been very active. They've done one webinar with the Small Business Administration about the SBA's emergency disaster loans. And I know they're helping our business community with the application, just finding their way through the application process. And we're looking at the financial implications of this to our budget. There's a lot to deal with, but I can tell you that the city and city administration is dealing with this on a daily basis.
For Director Chawla, what about post-symptomatic and contagious? This is a very real thing. Are they quarantining after symptoms have abated?
So yes, so if it's for people who are positive, there had been a requirement early on that people get cleared, so tests that show that they no longer have the virus. But I think that as there is wide community spread, it's a matter of time. So a certain period of time after the last symptom, and I am forgetting at this moment how many days that is. I'm sorry. I think I'm not going to say. But there's guidance on our website that provides additional information about what to do when you're positive to avoid exposing other people. But I'm not going to remember the exact number of days.
But while we're speaking about testing, I'm just going to slip in a question. Director Chawla, you mentioned that the data that we're getting about in our county and city by city statistics is only as good as the amount of tests that are being done. And I know I heard the governor on NPR a couple of days ago saying that I think as of Tuesday, 150,000 of California's 40 million residents have been tested. What are you finding in Alameda County? Are we able to test those who are most symptomatic, or how is that working?
Sure. So a couple things I'll say about that. One is that because I think people probably heard that there were shortages of tests, not just here, but across the country, shortages of the specific supplies that you need to conduct the test, the swabs for the swabbing or the reagents for the chemical component in the laboratory. And those things are becoming more available. Still, some have shortages, but they're becoming more available. And testing happens in a number of places. Testing can happen in your doctor's office. Testing can happen at testing sites. But because of the shortage, there had really been a priority placed on people who were symptomatic, so that we could identify people who were positive, and the people most likely to be positive that we knew and contagious were the people who were symptomatic. So there was a focus on testing them so we could isolate them and keep them from infecting other people. But now that there's more widespread community transmission of the virus, it is important for us to test more people. And it's also important for us to have an understanding of how many people who are asymptomatic are positive, because the testing now is also biased to people who are symptomatic, because that's that's the qualifications for the testing. So it is likely that once testing becomes more widely available, as it is continuing to become every day, that testing will be more accurate and more and available in different settings, not just in your own physician's office, but in testing sites and other things. So we have a few testing sites in our county that are testing symptomatic folks, but I've seen many, my team is looking at many different proposals to expand testing in our county.
Following on that, somebody's asked, where are the testing locations within the county?
So Hayward Fire has opened up a testing location at their fire station, although I think that they're looking to move it to another location in Hayward. Fremont Fire Department has also opened a testing site. Oakland has opened its own testing site as well. And I think those are the most publicly available ones, but still your own physician's office would be an appropriate place to get tested.
Here's another question for you, Director Chawla. Somebody is just remarking that the current research that's happening is amazing. Results are happening so quickly, and they'd like to know if you have heard or read anything in the last week that seems particularly remarkable.
One thing, yes, I love that question.
I've got really smart residents. I'll just put that out there.
The thing that is most interesting to me is testing for people to determine whether people have been exposed to the virus and what that means for economic recovery. So when we are in a period where we all have to shelter in place, and it's having an effect on our economy. And a question I get asked a lot is, well, what does coming out of this look like? Is it a phased out approach? And one thing that is really exciting to think about is, if you think about people who have had exposure but either have not become sick or were mildly ill and now are well, they are likely the people who we're going to be relying on to be the first of the workforce that goes back to providing functions in our community, because we know that they are, at the very least, if not immune, then they are very unlikely to get very ill if they contract the virus. So they are one of the keys to returning to economic activity.
Here's another question about the modeling. Do we yet know if this virus models things like the measles, where antibodies build up for immunity, or if it is more like the flu, where it can come year after year?
I don't think that there is definitive information on that, but what we hear more is that there are other waves of it coming. So I just read something in that there's another wave in Asia,
Right.
but we don't know what that looks like. But I haven't heard anything that really compares it more to measles.
Are you hearing anything about a vaccination? I mean, I think what little I've heard is that it won't happen this year, but maybe next year.
That's what I've heard as well.
But maybe we're closer to developing some antiviral drugs that would at least help treat people.
Yeah, that may be true too. I want to point out, I know that there's a lot of fear, justifiable fear out there, but I still think it's important to point out that 80% of people who get the virus do not develop severe illness. And so I think that we definitely need treatment, and the disease moves rapidly, and people who do get severely ill, and those folks will need treatment. But for the majority of people, we will either not know we have it or have mild symptoms.
That's a very good point, and I find that reassuring. I hope our listeners do as well.
Here are a couple more on testing. Will we be able to get tested for antibodies in case we already had it and didn't know? And then I'm just going to give a second question, which is that if there are enough tests, what about the idea of testing all essential workers currently in the community in order to ease the anxiety of those who must go out to these places?
Yes. So on the antibody testing, that was the most exciting thing I heard in the research in the last week. That's the same test that caller is referring to. And then around it, testing essential workers, one of the things we're looking at is how to be very strategic with how we implement testing. Because if we do it in a way that helps us know more about certain populations like first responders or certain geographies or certain conditions in which people live, then that might have better insights and better ability to have us contain. So we're looking exactly at that thing right now in the way that we would expand testing.
Mayor, somebody has asked if there has been an increase in crime in our city.
Not that I am aware of. I will say that crime is not taking a holiday for this pandemic, so our police officers are still busy. I have not heard, and I'm in pretty close constant communication with the police chief, I have not heard that there's been an increase. But speaking of the police, we get calls and emails from people complaining that, I saw these people out here congregating unsafely. And certainly if you see that, call the non-emergency number for APD. It's not a 911 call, but whenever possible, if you're out taking a run and you see that parent cutting the caution tape around the swing, it's okay to say something. If you see something, say something politely, respectfully. But we're a community. We don't have to be anonymous strangers. But say from your safe distance, hey, I'm just so worried about you doing that, because did you know those swings are taped off because COVID-19 virus could live on them, and that little child could be exposing themselves and you. But so everything doesn't have to be a call to the police, but we hope people can exercise the necessary self-discipline to not go out in big groups. And I have to say, I'm pretty proud of my city. I'm very proud of my city. My husband and I take a walk every evening, kind of the early evening, and we try to go to different neighborhoods. And they're out doing their walking and exercising, but they really do seem to be observing. For the most part, the vast majority are observing what they need to do. But then I just listened to an epidemiologist this morning on NPR explaining that even if you just have a couple of what he called cheaters who aren't doing this, it's just, it's keeping us from flattening that curve that we so need to do. We're learning a lot of new technology, terminology these days too. There was nothing new to Director Chawla, but we're all learning. And short answer to the first question, I do not think there's been an uptick in crime, but the police still at any given shift have only so many officers out. And so we want to make sure they're able to do their jobs, but they are here to keep us safe in every sense of the word.
Can I add something to what you just
Please.
said about compliance?
Yeah.
So one interesting bit of information, we are doing predictive modeling to help us understand what to expect in our future. We're fortunate that our health officers, as you said, acted early, and I think that that is part of the reason that we have a tiny bit of luxury of time to understand what the epidemic is doing in other places and help us plan, and using modeling based on their experience. So the modeling is very, very sensitive to the sheltering in place, compliance with the sheltering in place. So right now, there's interesting cell phone data that tell us that 40%, that we are less mobile by 40% than we were before the order. So in our county, we are 40% less mobile than before the order was implemented. And in our modeling, if we put in that 40% versus 10%, say we're only 10% compliant, the number of our cases would go up by 3. So the number of hospitalized cases would triple if we backslide to a 10% only compliance. At 40%, we are well on our way to ensuring that we have adequate healthcare capacity to serve everybody who is going to need care related to COVID-19 when they need it, in the location that they need it. So it is very sensitive to the compliance with sheltering in place.
And in that vein, we would do even better if we could get more than 40% less mobile.
Absolutely.
And Director Chawla, how are we doing as far as equipment for our medical care providers, the PPEs, gowns, masks, goggles, all the things they need?
Yes. So we have a whole storeroom of personal protective equipment that we are supplying in priority order to the providers in our county. Hospitals and frontline healthcare workers are the first in line to get that protective equipment, which includes masks and gowns and all of the things you said. And we have been able to fulfill nearly every order. I want to say that last I looked, we had 700 requests in our county for supplies, and we were in the process of filling or had already filled more than 500 of them in that priority order. And we have what's an adequate supply of masks and hand sanitizer for those settings. Where we have issues across the country is in gowns and other protective equipment in hospital settings. So we're continuing to procure them as much as possible. We have received some of those supplies from the national stockpile and also from the state, and we've put in requests for additional, but we are continuing to monitor them and make sure that we are distributing them to our facilities in real time so that they can replenish any low stock that they have.
I'm going to slip in one more question. It just reminded me of nursing homes. We have seen sadly, some deaths in nursing homes. I think Hayward in our county and maybe Orinda in Contra Costa County. And I know on the conference call the other day, by the way, for everyone listening, once a week, Director Chawla's agency hosts a conference call for the elected officials and also state and federal representatives in our county and brings us up to date on the latest developments. And you did mention in the call some enhanced protocols, or can you talk to us just a little bit about what's being done for the nursing homes?
Yes, we are concerned that nursing homes, that the conditions within nursing homes make them, because they're closed systems for the most part with visitors coming in and out, make them particularly vulnerable, and plus the demographics of the population in nursing homes makes them particularly vulnerable to severe disease related to COVID. So we have a task force that is comprised of our public health experts, as well as our behavioral health experts, to your point earlier, Mayor Ashcraft, and our infection control experts who are going into into nursing homes around the county, those that have positive COVID patients and not, to provide additional guidance. We're also looking, our health officer is looking at releasing additional guidance for nursing homes as well. I want to say too that our healthcare facilities, our hospitals and other facilities have really been supportive in stepping forward to help fill in the gaps when not just residents of nursing homes, but also workers in nursing
Staff,
homes.
yeah.
Are affected, so that we have sufficient trained staff on site. Our ambulance company, for example, has also stepped in to offer EMTs and paramedics to help support nursing homes during this.
Oh, so
Here's
good to
another
know. Yes, Sarah.
Here's another question, and I have a bunch of questions. And anything
Okay.
that we can't answer today, we're going to add to our frequently asked
Okay.
questions document
Okay.
that we'll release next week. So, but for Director Chawla, what are the requisites to end the shelter-in-place order?
Well, it's not. It's going to be a process, I would say. We are going to have to look at the new cases that are coming, being diagnosed in our county. We're going to look at our healthcare capacity and utilization of our healthcare resources. We're going to look at data around the compliance with the shelter-in-place order and how that's impacting where our curve is going. I wish I could give a more definitive answer, but all of those things are elements that are moving in real time that we are also monitoring in real time.
So similarly, here's somebody asking what viral control programs are being planned now so that the shelter-in-place can be removed. They note that if we don't have widespread testing, tracing, quarantine, and sanitation of public spaces, cases and clusters will spike again the minute the shelter-in-place is lifted.
Well, that's a good question. I think that the folks who had been positive and come out of COVID-19 are going to be key to continuing to open up our communities. But also the focused testing and isolation that I mentioned earlier, looking at how we can focus our testing efforts on certain populations or certain geographies or certain conditions, will also help us in that regard.
Here's somebody asking, what about those who don't develop immunity? Evidence suggests many people have A, relapse or reoccurrence within weeks of recovery, and B, develop no immunity. What's being done to address that?
I think still the principles around testing and identification as much as possible is key, and continuing with the shelter-in-place order and covering your face. All of those things will protect people who don't have immunity.
And here's one saying, what about the new reports that show COVID may have already been in the Bay Area as early as November and that we've already hit our peak?
Our data don't show that we've hit our peak at this moment. And if that's true and I'm wrong, I would be happy to be wrong.
I have a couple of questions for the mayor about the rent relief ordinance that has been adopted by City Council, both asking questions about what are the relief, what relief is available to renters, but then also saying, what about the renters who can pay, what's going to make sure that they do pay their rent?
Well, the honor system, the way it works is that at the end of the specified time period during which you cannot be evicted for non-payment of rent, then when the health emergency declaration is finished plus 30 days from that day, the ordinance specifies that you do begin paying your monthly rent and then paying back your the rent for however long it is. I hope it's not too long, in increments and installments, because we're giving you up to 6 months to do so. So, I mean, certainly if you are able to pay something, and we encourage people to talk to your landlords. More communication is always better than less communication, and everyone is in this together. I mean, I hope we know that by now, that for a landlord not getting the rent payment, they have likely have a mortgage payment, a property tax to pay. There's also relief for landlords. They're considered small businesses, but nonetheless, this is all unfolding in real time. So it's, we're not going to be out policing, are you able to pay something? But this is the protection we've put in place. And I have faith in people. I think they're going to do what they're able to do. But I also know that there's just a lot of financial hardship, uncertainty. I mean, our food bank has seen its demand just increase dramatically. So I believe that everyone will do the best they can. And also the council has the flexibility as we get more data and more information. I asked staff to reach out to our landlord community to get their feedback, because we've worked with the renter community too. But we can always refine this ordinance if we need to. But right now we think we've put pretty strong protections in place. And I would say we're among the leaders in the Bay Area in our county doing so.
Here's a question for both of you, Mayor within the city of Alameda, and then Director Chawla for other jurisdictions. How are the quarantines being enforced?
So generally, it's by guidance, and there is no need for enforcement beyond provision of guidance. We are also making it easier for people to comply with quarantine by, for example, in our homeless population, we are providing a hotel room for people to quarantine safely in hotels. So we've not had issue with that. Our health officer has the ability to issue isolation and quarantine orders, and she's issued blanket isolation and quarantine orders that, as the mayor alluded to earlier, is on the honor system, and we are finding that people want to comply and are being compliant.
From the city's perspective, I do not know who those 22 people are who have tested positive in Alameda, but they have doctors or other healthcare providers or someone who did the testing. And I know I have heard that doctors are checking in daily with their patients who have tested positive and checking on them. And again, these are obviously, if you're hospitalized, you are quarantining if your symptoms were that serious. But as Director Chawla earlier indicated, 80% of those who test positive will not have serious symptoms. And so your doctor's checking in with you, and presumably you want to get better. You don't want to infect others. And so I think the safeguards, as much as we could do, are in place.
Mayor, here's another question for you. How is the city handling expenses now and in the future with the dramatic loss of sales tax income?
Yeah, well, some of that, and as Director Chawla indicated, we will eventually look to FEMA, the Federal Emergency Management Agency, to reimburse up to 75% of our expenses. And I know for Sarah Henry, our PIO, you're at the Emergency Operations Center every day. And I know that scrupulous record keeping is being done because it's very important to have that, because you pay now and then you submit your request for reimbursement later, but there's strict record keeping guidelines that have to be followed. And I mean, for a lot of this, the answer is we're going to have to wait and see to readjust some budgets. I know the city manager is doing that now. I think every day he's working with the finance department. And at our next council meeting, which is April the 21st, we do have an item to go over the budget and what we need to do to, as you said, backfill some of this lost sales tax. The good news for the city is that we have a reserve in our general fund, a pretty healthy reserve, because we've had some good years. I was the one, and I'm sure my colleagues were too, but I was always forever saying, look, just because times are rosy now doesn't mean it's going to continue. I thought it was going to be more just financial markets or whatever, the housing market would cool off or whatever. I didn't foresee a pandemic, but nonetheless, we have our rainy day fund. But how long that will last, how long it will need to last, still remains to be seen. But that is why it's so important on so many levels for everyone to take this shelter in place order seriously, because the sooner we get past this crisis, the sooner we do get to open up, be back in business, and go about doing our all the things we do in our daily lives. I mean, people want to go back to work. They hope they have jobs to go back to. And so the city is following the implications closely. And I will say we're also looking to the state and federal government to bring some relief to our cities. So it's an ongoing process, and we're not in this fight alone. We've got allies.
I think I'll take the next 3 questions that are in line, and then maybe if you can each say something before we close out. I think that would be a great way to end this town hall, which has been really wonderful. We've had about 73 people participate, and it's been great.
Yeah.
Okay, another one for the mayor. What are some steps that the city can take to help Alameda small businesses, and most especially restaurants?
Well, one of the things we're doing now, and you can thank Sarah Henry and also the business associations. The business associations in Alameda are doing a great job for their members. The Chamber of Commerce, DABA, WABA, GABA, all those acronyms. So on our city's website, and I've seen others, the Chamber's doing it too, is a list of all of the restaurants that are providing, that are open for takeout or delivery. And so we have encouraged, your mayor has recorded a couple of videos of when I've gone out to pick up my takeout. Last night it was from Tucker's Ice Cream. It was great. But anyway, so we encourage everyone to frequent these businesses. They are trying to stay open, keep a skeleton crew going. Some of them are trying to keep their full staff going. And you don't want to cook for yourself every night anyway. And so if you can, please order your takeout. They'll deliver if you can't go pick it up. And they're all complying with the safe social distance requirements. You can buy gift cards for businesses, for retail businesses and restaurants now. Because again, this is where we are now, but we're going to be open for business when it's safe to come out again. And so you can use those gift cards, but that money helps these businesses now. And we are going to continue to meet to see what can be done. I just was on the phone yesterday with Madeline Sadek, who's the executive director of our Chamber of Commerce, and she wants to set up a webinar with some state and federal elected leaders. So I'm working with her to do that so that we can get all, and county, state, county, and federal leaders, so we can find out what other assistance might be available for our small businesses.
Here's a question for Director Chawla. Do you anticipate after school programs opening this summer as a stepping stone before schools open in the fall?
I know that school or educational facilities are what the health officers are looking at as how we might, or where we might be able to return to some easing of the shelter-in-place requirements, but I don't believe that any decisions have been made at this time.
Okay. Here's a question. I did not get a flu shot this year. Should I try and get one now?
Always good to get a flu shot. It protects you from the flu, and and I think it's always a good idea.
Okay, and then the last question. Looks like Alameda County Fire is doing all the testing. What would it take for the county fire to come to Alameda for testing?
So I can tell you that our city manager, Eric Levitt, sent an email to Director Chawla a week or 2 ago, offering our city, if needed, as a testing site. And so we would be happy to do our part. What I can tell you right now is that the Oakland site, I believe, is the Coliseum, maybe the Coliseum parking lot. And I do believe that there is an arrangement for our public safety first responders to go there to have their testing. So Oakland Coliseum is not very far away. from Alameda, but we stand ready to do our part. I will throw in quickly, just from talking about our unsheltered population, we were able to secure 4 FEMA trailers that should be in place now at Alameda Point, and those are being set aside for members of our unsheltered community who are medically frail and need to be removed from encampments so that they don't contract the disease. And we're working with social service agencies who identify those individuals.
So I think that'll wrap up all of the questions that we have. Again, I'll post additional questions on our frequently asked questions document that we're going to publish next week. But Dr. Chawla, do you have any final remarks?
It would be repetitive to what I said earlier, but that we are doing a great job of sheltering in place in our county. A 40% reduction in movement is fantastic. And we just need to keep it up for a little while longer, get better even if we can. And because it's going to really make sure that we stem the spread of COVID in our county, and that we make sure that our healthcare resources are available for people who need them, who do get sick. And still, the best way to keep up the good work is to shelter in place, to wash your hands frequently, to maintain your social distance at 6 feet apart, and to cover your face when you have to go out for essential activities. And I just want to thank Mayor Ashcraft and all of you for being compliant and being in with us together, because that's the only way we're going to get through it, is together.
Thank you, Director Chawla, and I cannot thank you enough. From the first time we sat down and met, I was so impressed with your body of knowledge and your deep background in public health. And every week when I've listened to you on these weekly calls, I continue to be impressed and also just so grateful that you are helping us keep our community safe. So I wanted the opportunity to have my residents hear from you directly. This session is being recorded and it will be posted on our city's website, so others who weren't able to join us in real time can still hear all the good information you brought us. So again, I know how incredibly busy you and your agency are these days, and we are so grateful for you for sharing your time with us today. So thank you.
Thank you.
Thank you, Mayor. Thank you, Director Chawla. Thank you, everyone, for participating. We do plan to do this every week and hope you'll continue to join us. Meantime, please go to alamedaca.gov/alerts for daily COVID-19 updates and information. Thank you. Stay home, stay safe, and save lives.
Thanks, everybody. Take care. Stay safe. Bye-bye. Thank you.